In this video, today we are going to see and learn about alpha stat and pH stat during DHCA under the CPB Simplified Series. DHCA is the technique which allows complete cessation of blood circulation for a limited period along with optimal protection to all the organs. DHCA provides bloodless surgical field so that complex surgery on heart and complex surgical procedures on great vessels could be performed with ease. DHCA provides brain protection by relying upon the protective effects of deep hypothermia on cerebral metabolic rate of oxygen consumption. Before discussing about alpha stat and pH stat, let us see some basic principles associated with it. Henry's law. The concentration of a solute gas that is dissolved in a solution is directly proportional to the partial pressure of that gas above the solution. As per Henry's law, during hypothermia, increased solubility of the carbon dioxide in blood results to decrease in PaCO2. During hyperthermia, decreased solubility of the carbon dioxide in blood results to increase in PaCO2. During hypothermia, the solubility of carbon dioxide increases. As a result, PaCO2 decreases, and also there is a decrease in dissociation of weak acids and bases in the body, which results in alkaline shift of blood pH. For example, a blood sample taken from the patient at 37 degrees centigrade has a pH of 7.45 and PaCO2 of 40 mmHg. The same blood sample, which is temperature corrected to 27 degrees centigrade, shows a different value of pH as 7.55 and PaCO2 of 20 mmHg. This is because when the solubility of CO2 increases in blood, the value of PaCO2 decreases, resulting in alkaline pH. CO2 is the potent cerebral vasodilator and profoundly affects cerebral blood flow. Hypercapnia. It causes marked dilation of cerebral arteries and arterioles and increased blood flow. Hypocapnia. It causes constriction and decreased blood flow. Oxygen is carried throughout the body primarily by a protein molecule called hemoglobin, which is present inside red blood cells. Oxygen can also be carried throughout the body by dissolving in blood plasma, but this dissolved portion only constitutes a very small portion of the total amount of oxygen transported into the bloodstream. Only 2% of oxygen in the bloodstream is dissolved directly in the plasma component of blood compared to 98% of oxygen in the protein bound state to hemoglobin. The Oxy-hemoglobin dissociation curve is a vital tool for comprehending how blood transports and releases oxygen. It helps to describe the relationship between oxygen saturation, which is the percentage of hemoglobin bound to oxygen, and partial pressure of oxygen in the blood, which is the amount of oxygen dissolved in the blood. During hypothermia, the oxyhemoglobin dissociation curve shifts to the left side, resulting in alkalosis, hypocapnia, increased affinity of oxygen to hemoglobin. During hyperthermia, oxyhemoglobin dissociation curve shifts to the right side, resulting in acidosis, hypercapnia, decreased affinity of oxygen to hemoglobin. The two basic strategies used in acid-base management at different body temperatures during CPB and DHCA are alpha stat management and pH stat management. The alpha stat management strategy does not correct for pH and CO2 changes induced by hypothermia, resulting in hypocarbia and alkalemia. In alpha stat method, ABG is uncorrected for actual blood temperature. This allows the pH to rise and pCO2 to fall naturally with cooling. Relative respiratory alkalosis at the patient's actual body temperature. No extra carbon dioxide will be added to the circuit. The advantages of alpha stat management are it preserves cerebral autoregulation even at the low mean arterial pressure. The cerebral autoregulation is a homeostatic process that regulates and maintains cerebral blood flow constant and matched to cerebral metabolic demand across a range of systemic blood pressure. It keeps electrochemical neutrality and intracellular pH intact. It causes cerebral vasoconstriction and reduces cerebral blood flow, which prevents intracranial hypertension and subsequently avoids cerebral edema. It causes relative hypocarbia, which leads to cerebral vasoconstriction and reduces blood flow. As a result, it decreases the risk of microembolization. On cellular level, protein and enzymatic functions are not disturbed. The alkaline pH improves cerebral protection during the ischemic insult of circulatory arrest. The disadvantages of alpha stat are because of cerebral vasoconstriction due to the low pCO2 during hypothermia, cerebral cooling is less efficient and non-homogeneous. The cerebral oxygen consumption is reduced. Cerebral steal phenomenon occurs in circumstances of additional aortopulmonary collateral blood flow, especially in congenital anomalies. Since it reduces cerebral blood flow, it may result in cerebral dysfunction, especially in neonates post-DHCA. Now let us see about pH stat management. If the pCO2 is corrected to the patient's actual temperature and that value is kept within the normal, this is called pH stat management. PaCO2 is maintained at 40 mmHg and the pH is maintained at 7.40 when measured at the patient's actual temperature during hypothermia. During cooling, sweep gas flow is reduced to keep higher pCO2. Otherwise, if necessary, add carbon dioxide to the inspired gas via the oxygenator to counteract the increased solubility of carbon dioxide in the blood at lower temperatures. The advantages of pH stat management are hypercarbia causes cerebral vasodilation, resulting in increased cerebral blood flow, which implies increased jugular SpO2 and allow increased oxygen delivery to the brain. Increased cerebral blood flow in conjunction with reduced CMRO2 allows faster and homogeneous cooling of the brain. pH stat is particularly beneficial in cyanotic neonates and infants because it shifts more blood flow away from the aortopulmonary collateral circulation towards the cerebral circulation, improving cerebral cooling and oxygen supply. It provides better neurobehavioral development after DHCA in children. It counteracts leftward shift of oxyhemoglobin dissociation curve caused by hypothermia and alkalemia and offloads hemoglobin to the tissue and makes oxygen available for the tissues, which may optimize cerebral and myocardial function. The disadvantages of pH stat management are loss of cerebral autoregulation. The cerebral blood flow becomes pressure passive because of vasodilation of brain vessels, which increases intracranial pressure. It increases the risk of cerebral microembolization and cerebral edema. Due to increased cerebral blood flow, mismatch of cerebral blood flow and CMRO2 occurs. It is little complex to maintain pH stat comparatively to alpha stat due to the PCO2 maintenance during DHCA. Conflicting evidence of many studies comparing the two strategies makes it extremely difficult to favor alpha stat over the pH stat management, and also there is a continuing debate as to which management strategy is better for neurodevelopment outcomes, especially in neonates undergoing DHCA. So, what the world is following? There are four different strategies currently available: pH stat management for both cooling and rewarming, alpha stat management for both cooling and rewarming, pH stat for cooling and alpha stat for rewarming, and alpha stat for cooling and pH stat management for rewarming. By analyzing the advantages and disadvantages of both alpha stat and pH stat management strategy during DHCA, pH stat provides improved brain cooling and less time was required to achieve uniform cerebral deep hypothermia. Vasodilation due to pH stat results in increased cerebral blood flow, which improves oxygen delivery to brain tissues, giving better results in the neurological outcomes, especially for pediatric population post DHCA. Also, both pH stat and alpha stat management resulted in similar cerebral protection after DHCA. So, to conclude, a combined strategy of pH stat management during cooling and then switching to alpha stat management at circulatory arrest and during rewarming will provide optimal cerebral protection. Thank you for the overwhelming response for this channel. Those who haven't subscribed my channel, please subscribe the channel for more videos on perfusion related topics. Thank you. See you on the next video.